One of the most alarming health topics today is the huge rise of cancer in the United States and worldwide. Even more alarming is the increase in cancer in the younger population, which was rare to see just a few decades ago. And I don't understand why people are not talking about it. The scary part is that cancer in the younger population is often way more aggressive and less responsive to conventional treatment like chemotherapy and radiation and surgery. I'm Dr. Rizwan Chaudhry, and I've spent the last decade helping people get healthy through weight loss surgery and helping them keep their weight off for good through personalized coaching. My goal on this channel is to educate people on what the most prevalent diseases are in today's world and what you can do practically to reverse and prevent them. Now, getting back to our topic, experts from Yale University have cited that they're seeing more aggressive breast cancer in younger females compared to older females. And they're also seeing more complex and higher stage colon cancer in younger men and women compared to the older population. You know, cancer used to be a disease of the older population 30, 40 years ago. It was freaking rare to see a 30-year-old woman with metastatic breast cancer. The American Cancer Society this year just published data that shows that since the 1990s, the incidence of cancer has risen most sharply in people younger than 50. In fact, today the leading cause of death in men younger than 50 years old is colorectal cancer. So what else have we seen on the rise in the last 4 decades? What can explain the sudden appearance of cancer in the younger population and the overwhelming amount of cancer in general? Well, that's obesity in adults and especially in the younger population. During the same time we have seen cancer skyrocket, we have seen a 200% increase in the rate of obesity. In fact, obesity has been directly linked to breast cancer, colorectal cancer, prostate, pancreatic, esophageal, kidney, liver, the list goes on and on. This is data coming straight from the National Institute of Health, or the NIH. So what is this relationship with being overweight and developing cancer? Well, it all goes back to one of the main things I like to talk about in this channel, and that's chronic inflammation coming from being obese. Inflammation caused by fat cells or adipocytes leads to oxidative stress, which is stress at the level of the cell, which leads to DNA damage, which then facilitates the onset of tumor formation. A study published this year out of the UK showed that nearly half of all cancers are linked to obesity. That's crazy. 50% of cancers are related to being fat. Researchers followed 4 million adults over several decades and found that obesity was associated with more than 30 types of cancers. So now that you know there is a direct correlation between obesity and cancer, what can you do to mitigate the risk? Well, you need to start losing weight and you need to do it relatively quickly. The longer you're obese, the more inflammation you're generating in your body. The more inflammation circulating in your body, the faster the formation of cancer. Immediately making changes to your current diet and moving away from ultra-processed foods found in the grocery stores, fast foods, and high sugar drinks is a good starting point. You need to decrease the fuel that is feeding these cancer cells. Cancer cells thrive on sugars and free radicals caused by ingesting processed foods. An important consideration is the significant impact of bariatric surgery in reducing the risk of aggressive cancer and cancer-related death. At the Mayo Clinic, they reported a study that looked at obese people who underwent weight loss surgery versus those who were obese who did not undergo weight loss surgery. After following these two groups for over 10 years, they found that the obese people who had bariatric surgery reduced their risk of cancer by 33% compared to those who did not have surgery. And this risk reduction was for all cancer types, not just the most commonly associated ones that we see with obesity, such as breast, endometrial, colorectal cancer, ovarian cancer. There are countless other studies that show the same thing. Obesity, cancer. Lose your weight, lower your risk for cancer. It's really that simple. Now, if your BMI is over 30 and you've been struggling to lose weight, despite eating healthy and doing your best to exercise, you may need to seek help with a bariatric surgeon. It's really not worth wasting month after month, year after year, and not getting results. It could be literally costing your life if you don't do something about it. Make sure you seek out a bariatric surgeon who is board certified and fellowship trained. For those of you interested in a free copy of the weight loss surgery guide I give to all my patients, type in weight loss for good in the comments section below and I will make sure my team gets you a copy. So go out and get yourself educated. There's no one coming out there to save you. These are real problems, real dangers to your life that you are dealing with, and there's something that you can do to change it. Do yourself and your loved ones a favor. Please don't be a statistic on some study. Thank you for watching this video. If you found this content useful, please comment, like, and subscribe. There are people out there that are struggling with obesity that may find this information very useful, and spreading this far and wide is what we need to do to combat this epidemic of obesity.